What is the main purpose of adding a chemical prime solution, such as balanced crystalloids or albumin, to the CPB circuit before starting bypass? A. To check if the roller pump can reach maximum RPM. B. To displace all air from the tubing and filters to prevent immediate massive air embolization. C. To systematically destroy the patient's remaining white blood cells. D. To increase systemic vascular resistance artificially. Answer: B. To displace all air from the tubing and filters to prevent immediate massive air embolization. Explanation: before a patient can be connected to a CPB machine, every millimeter of the tubing, reservoir, oxygenator, and filter must be filled with fluid, primed, to completely flush out all ambient air. This initial fluid choice induces therapeutic hemodilution once bypass begins. Which device in a modified CPB circuit allows for the selective collection, washing, and concentration of shed blood so that pure red blood cells can be rain-fused? A. Hollow fiber oxygenator. B. Centrifugal pump head. C. Cell saver, autologous blood recovery system. D. Inline blood gas monitor. Answer: C. Cell saver, autologous blood recovery system. Explanation: the cell saver is a separate scavenging system that collects shed field blood, centrifuges it to separate red blood cells from debris and plasma, washes the cells with sterile saline, and concentrates them into a high hematocrit product for safe rain fusion, drastically reducing the need for donor blood. What does a sudden drop in the venous line blood temperature during cooling indicate to the perfusionist? A. The patient is generating excess metabolic heat. B. The heat exchanger has successfully initiated the cooling phase by dropping the water temperature. C. The arterial filter purge line has become completely occluded. D. The centrifugal pump has failed. Answer: B. The heat exchanger has successfully initiated the cooling phase by dropping the water temperature. Explanation: the heat exchanger is physically integrated into the oxygenator system. When the cooling phase begins, cold water is circulated through metal tubes or compartments adjacent to the blood pathway, safely lowering the temperature of the blood entering the patient's arterial system. What is the specific purpose of the retrograde autologous priming (RAP) technique? A. To deliberately overhydrate the patient before a long bypass run. B. To use the patient's own blood to displace the crystalloid prime in the circuit, minimizing hemodilution. C. To flush the cardioplegia line backward into the venous reservoir. D. To test the integrity of the arterial line bubble detector. Answer: B. To use the patient's own blood to displace the crystalloid prime in the circuit, minimizing hemodilution. Explanation: RAP involves using the patient's own arterial and venous blood pressure to drain the crystalloid priming solution out of the CPB lines into a waste bag just before going on bypass. This reduces the total volume of clear fluid introduced into the patient, maintaining a higher post-bypass hematocrit. If the arterial line pressure monitor alarms due to high pressure, which manual check should be performed first? A. Increase the sweep gas flow rate immediately. B. Inspect the arterial line for any closed clamps, kinks, or malpositioned cannulas. C. Drain 500 milliliters of blood out of the venous reservoir. D. Turn off the heat exchanger water supply. Answer: B. Inspect the arterial line for any closed clamps, kinks, or malpositioned cannulas. Explanation: high arterial line pressure indicates severe downstream resistance between the pump and the patient. Running a pump against an obstructed line can cause tubing lines to rupture or blow off connectors. The immediate clinical action is to check for physical kinks or mistakenly left on surgical clamps. Which element of a cardioplegia delivery system regulates the precise ratio of blood to crystalloid solution given to stop the heart? A. The arterial line filter. B. The oxygenator sweep gas blender. C. A specialized duplex roller pump or proportioning pump system. D. The hemoconcentrator vacuum valve. Answer: C. A specialized duplex roller pump or proportioning pump system. Explanation: blood cardioplegia systems typically deliver blood mixed with a hyperkalemic crystalloid solution at specific ratios, e.g., 4:1 or 8:1. This is precisely controlled using a duplex pump setup where two separate rollers or calibrated lines advance simultaneously to guarantee the exact intended mixture. What type of coating is frequently applied to the inner surfaces of modern CPB tubing to improve biocompatibility? A. Heparin or hydrophilic polymer coatings. B. Microscopic latex shields. C. Antibiotic ointment washes. D. High-friction silicone dust. Answer: A. Heparin or hydrophilic polymer coatings. Explanation: to mitigate the massive systemic inflammatory response system, SIRS, triggered when blood contacts foreign plastic, manufacturers coat the inner surfaces of the circuit with biocompatible materials like covalent heparin bonds or advanced synthetic polymers that mimic the natural endothelial lining. During CPB, how does an airlock inside a gravity drainage venous line alter the circuit's function? A. It speeds up the clearance of carbon dioxide. B. It completely halts or drastically reduces venous drainage because air breaks the continuous fluid siphon. C. It spikes the preoxygenator pressure instantly. D. It causes the arterial pump to switch to reverse mode automatically. Answer: B. It completely halts or drastically reduces venous drainage because air breaks the continuous fluid siphon. Explanation: gravity-driven venous drainage relies entirely on a continuous column of fluid from the patient to the reservoir. If a large bolus of air enters the line, air entrainment, it disrupts the hydrostatic siphon effect, locking the line and stopping all passive drainage into the machine. Why is a one-way valve mandatory on the suction line of a left ventricular vent pump? A. To keep the vent line from draining the cardiotomy reservoir empty. B. To prevent the accidental pumped delivery of air or blood backward into the patient's left ventricle if the pump is reversed or stopped. C. To separate the crystalloid prime from blood elements. D. To measure the precise temperature of the left atrium. Answer: B. To prevent the accidental pumped delivery of air or blood backward into the patient's left ventricle if the pump is reversed or stopped. Explanation: left ventricular vents actively pull blood out of the heart via a roller pump. If the pump stops spinning or is accidentally rotated backward, a dangerous volume of air or unoxygenated blood could be pushed directly into the heart. A one-way valve physically prevents any retrograde flow. What is the role of an anesthetic vaporizer when attached to a CPB gas blender? A. To humidify the sweep gas before it hits the fibers. B. To deliver volatile agent, like isoflurane or sevoflurane, directly into the sweep gas to maintain anesthesia during bypass. C. To scrub extra nitrogen out of the circuit. D. To clean the internal housing of the oxygenator. Answer: B. To deliver volatile agent, like isoflurane or sevoflurane, directly into the sweep gas to maintain anesthesia during bypass. Explanation: because the patient's lungs are deflated and non-functional during bypass, traditional mechanical ventilation cannot deliver inhalational anesthesia. Vaporizers are therefore integrated directly into the CPB machine's gas lines so volatile anesthetics can pass across the oxygenator membrane directly into the bloodstream. Which physical mechanism drives gas exchange across the hollow fibers of a microporous membrane oxygenator? A. Active cellular transport channels. B. Passive molecular diffusion driven by partial pressure gradients. C. High-pressure mechanical compression. D. Microbubble injection directly into the red cells. Answer: B. Passive molecular diffusion driven by partial pressure gradients. Explanation: gas exchange in a membrane oxygenator operates on the exact same physical principles as the human alveoli, passive diffusion. Oxygen moves from the gas phase, high partial pressure, across the fiber wall into the blood, low partial pressure, while carbon dioxide moves in the exact opposite direction. What parameter does a transonic flow probe on the arterial line measure? A. The precise percentage of volatile anesthetic gas being delivered. B. The true volumetric flow rate, L/min, of blood returning to the patient using ultrasonic waves. C. The thickness of the fiber layers inside the oxygenator. D. The coagulation status of the venous blood. Answer: B. The true volumetric flow rate, L/min, of blood returning to the patient using ultrasonic waves. Explanation: while a roller pump can estimate flow based on RPM and tube size, factors like internal resistance or kinking alter actual delivery. Transonic or ultrasonic flow probes measure the actual physical movement of fluid inside the line, providing an independent, highly accurate reading of cardiac index output. Why is a dedicated safety pressure relief valve built into a hardshell cardiotomy reservoir? A. To keep blood from spilling out onto the floor. B. To prevent structural damage or pressurized air forces from building up inside the sealed reservoir if gas lines malfunction. C. To monitor the exact pressure inside the radial artery. D. To mix cold water with hot blood automatically. Answer: B. To prevent structural damage or pressurized air forces from building up inside the sealed reservoir if gas lines malfunction. Explanation: if gas or air is pumped into a closed, rigid reservoir faster than it can escape, internal pressure will climb. This can cause structural failure or, worse, force blood backward through the venous lines into the patient. A pressure relief valve automatically vents excess gas if the internal pressure hits unsafe thresholds. Which technique is most useful for correcting severe metabolic acidosis, low base excess pH, while running on cardiopulmonary bypass? A. Increasing the volatile anesthetic concentration. B. Administering sodium bicarbonate into the circuit and optimizing pump flow rate/oxygen delivery, due to. C. Lowering the sweep gas rate to 0. D. Raising the patient's core temperature rapidly to 40 degrees Celsius. Answer: B. Administering sodium bicarbonate into the circuit and optimizing pump flow rate/oxygen delivery, due to. Explanation: acidosis on bypass typically stems from inadequate tissue perfusion, low flow or extreme hemodilution. Perfusionists treat the underlying cause by optimizing pump flows and hemoconcentrating, while acute chemical correction can be safely achieved by introducing sodium bicarbonate into the circuit. What is the fundamental utility of a bridge line in a standard CPB circuit layout? A. It connects the arterial filter directly to the cardioplegia delivery lines. B. It links the arterial and venous lines directly together, allowing the circuit to circulate blood independently without involving the patient during troubleshooting. C. It serves as a secondary emergency drainage channel for the bladder. D. It allows the heater-cooler to dump extra water into the room. Answer: B. It connects the arterial and venous lines directly together, allowing the circuit to circulate blood independently without involving the patient during troubleshooting. Explanation: a bridge line is a crucial safety shunt. If a critical component, like the pump head or oxygenator, fails and needs to be replaced mid-case, the patient is safely clamped off, and the bridge line is opened. This allows the circuit to remain active and be flushed or debugged in an isolated loop before reconnecting to the systemic circulation.